Hello everybody, Dr. Jeff Lynch with McKinney and this is Dental Implant Talk. Today I'm going to answer the question, does a dental implant require any special care? Well, let's take a look at a diagram of a dental implant. Now, what this shows us is a healthy side and an unhealthy side. The unhealthy side is unhealthy because there's plaque built up on the tooth. So the first thing we need to do from special care is brushing and flossing. So that's not really anything special. That's the same thing you're doing with your regular teeth. Plaque is bacteria. Plaque will adhere to the surface of your teeth or crowns, whether they're regular crowns or implant crowns. And the plaque, if left, will work itself down under the gum line. Now, let's look at the attachment. The implant itself is a titanium screw. So this attaches to the bone two ways. The first is just the basics mechanics of a screw, the threads. It's screwed down in there. But the thing that keeps this from unscrewing is the fact that titanium is very biocompatible, so much so that the bone cells love it and attach to it. They literally fuse to the titanium, and this just locks that implant in place so that when you're chewing, there's nothing that can cause it to rotate. The implant is locked in and your tooth is completely stable. Now, if plaque gets down under the gum line and builds up, the first level of defense is a connective tissue attachment. The tissue is loosely attached to the base of the abutment and the top of the implant. Bacteria will cause that attachment to come loose, and the next thing it comes in contact with is the bone. Bone does not like bacteria. And after time, the bone will begin to go away, creating deeper pockets and bone loss around your implants. The same way gum disease does that to your regular teeth. So the first thing as far as care goes is plaque maintenance, keeping things clean, brushing, flossing, seeing your hygienist on a regular basis. The second thing we need to do from a care standpoint is protecting the implant from excessive lateral side-to-side forces that occur in people who grind their teeth at night. The implant is super strong. It can withstand regular chewing forces for a really long time. But what we know is that at night when people grind their teeth, the forces that they put on these teeth are side to side and excessive of anything that we generate while we chew. These forces can cause weakening and damage of the parts of the implant. The screw that holds the abutment to the implant is particularly at risk. And the bone around the crest, around the top of the implant, is also susceptible to going away with excessive lateral forces. So how do we manage that? How do we avoid those things? By having people who are grinders wear a grinding guard. This is a night guard. It's acrylic. It's made to fit a patient's upper teeth. The bottom surface is smooth. So when this clips on and they're grinding, we have a smooth surface for these bottom teeth to rub against, and no bumps, no lateral forces generated on the moving lower or the upper teeth. So two things we have to protect these implants from: plaque and bacteria, same as your regular teeth, and excessive lateral forces, same as your regular teeth. So I'd say they don't require anything special from care, just basic home hygiene and protecting them from the excess forces that are generated when you grind your teeth. Hope that answers your question. Look forward to seeing you at McKinney